Hello beautiful people, welcome to my YouTube channel. If this is your first time, my name is Miss Linda. Today we are spoiled. Trust me, we are spoiled. We have one of the amazing guests today. I'll leave it to her to introduce herself. Welcome.
Thank you, Miss Linda. Thank you very much. Hi, everybody. My name is Fonda, and I'm a pediatric physical therapist. That means that I'm a physiotherapist who is specialized in working with children.
Yeah.
I've been working with children since 2013, and it's just my big passion. And my big passion within working with kids is working with children with a disability.
So since 2013 you've been working with children? 2003?
Yeah.
2003 to now.
Yes.
Oh my goodness. That's over a decade.
I know.
Yeah.
Almost 20 years.
Yeah, almost 20 years.
So I worked in an organization with kids with disabilities. I worked in private setting. But my passion is really kids with disabilities. I really like to work with children with disabilities because you can have a huge impact on the life of the children and the family as a whole.
Yes. We have a guest.
Yes, we have it's my assistant.
Yes.
What's your name? Oh, Pia. So this is Pia. She is my daughter, and she's going to help me demonstrate, because we're going to talk about head control and neck control in children with developmental delays and cerebral palsy. Yeah. So Pia will be my assistant.
All right. You can now tell that you are you are ready to learn. So just get your pen, just get your book, and learn as much as you can. This video we are going to it's a more of a practical video, whereby we are looking at how we can help children who have issues with neck control, those issues with hand control. That's the purpose for this video. And we are focusing on children. Our focus today is on children. And because we know children who have developmental delays have issues with their neck and their hand control. We want the majority of those children are children with CP, cerebral palsy. Yeah. Would you kindly introduce her to cerebral palsy? Yeah. Because those are the children who are going to benefit with issues, who have issues with hand control and neck control.
Yeah. So cerebral palsy is quite a wide range of disabilities.
Yeah.
But it's the diagnosis is set when something in the brain has gone wrong in the first 2 years of life. So it can be during pregnancy, when the mother has had an infection which has been affecting the child. It can be during delivery.
Yes.
When, for instance, the child had lacks of oxygen by the umbilical cord around the neck. Or later in life when, for instance, there's been an injury to the brain that caused a lesion to the brain. Yeah. So, but per definition, it's usually in the first 2 years of life. Yeah. After that, we don't call it cerebral palsy anymore. So it's a condition that affects the brain. Once the lesion is done, you can't change it anymore. Okay. But it affects the body and affects the muscles at most. Yeah. So very often, I think what people mostly know are the spastic children, the children with like the spastic muscles that are difficulties moving. Yeah. That is one of the very prominent sign of cerebral palsy. Yeah. There are different types of cerebral palsy. The whole body can be affected, or only one side of the body is affected, or only the legs are affected. So those are the major three, what we call in the spastic cerebral palsy. So the brain lesion will stay the same throughout life. Yeah. But the complications through the body can change. Oh. For instance, if the muscle is getting very spastic, it will pull.
Apart from children who have cerebral palsy, who are other children under developmental delays who are likely have to issues with hand control and neck control?
Kids who are born premature very often have problems with their head control. Kids with the opposite of spastic cerebral palsy, who have a low muscle tone, also very often have difficulties with the head control.
That means Down syndrome?
Down syndrome, yes. Right. A very typical one is Down syndrome, yes.
Okay. Yeah. Now, take us through what are some of activities can we do? Maybe a parent can do at home,
Yes,
or they can
yes.
learn to help their children who have issues with neck control.
Yeah.
This is where parent to take your pen. This is where parent to take your books. This is where parent to just be keen enough. This is the place that you make sure you look and you understand exactly what's happening, because this activity Fonda is going to take us through. There are most of the activities that will help us, even with our children there at home. So Fonda, can you show us some of the activities that
Yes.
we can do to help children who have hand and neck control?
Okay. So we'll use my daughter Pia.
Yeah.
We practice a little bit, so
Yeah.
I hope it will be okay.
Yeah.
That she doesn't know too much what to do.
Yeah.
So you can practice head control in different positions.
Yes.
Depending on how good the head control is developed.
Yeah,
So
yeah.
the easiest where you can start is always laying on the back.
Yes.
Yeah?
Yes. Yeah.
Very easy. You just take a toy or you take anything that the child finds interesting to look at, and what you can do is you just try to see if the child can look at the toy and then turn the head. Can you turn your head like that? Yes. Try to follow.
So the child is like trying to follow the toy that you have.
Yes.
All right.
Yeah. So you want the child to follow the toy.
So
Look
that
left
one,
and right. Yeah, because every time you need to turn your neck, you're using your muscles.
Oh.
Hence, controlling your neck and your head.
Yeah.
So you can do that to the left and the right.
Does the toy need to have some sounds?
It depends. It would be nice. It can have bright colors. It can have sound. It can be anything where the child likes to look at. Sounds can be very interesting usually.
Yes. Yeah.
The light is in your eye. Okay. So, and you can do it left and right, but you can also make the child look down or look up. Try to move your head up. Move your head up. Head up. Good. So in this way, you need to make sure it's
So the child,
close.
as you turn the toy this way, the child stands this way.
You want the child to turn the head. Yes. Don't take it too far. Just make sure it's close by. You're sure that the child is able to see it. Yes. Once the child has focused on it, you can start moving.
Okay.
If the child loses its focus, you see that the eyes are not following.
Yeah.
Then you just stop and you stay there.
Okay.
They might not be able to use the whole range of motion, looking all the way to the left, all the way to the right. Maybe they're able to do just a little bit.
Yeah.
As long as you keep their gaze, and then you move to the other side,
Right.
and you move to this side. You do it very slowly, because one of the things with cerebral palsy, it's difficult to steer the muscles, to direct the muscles to do what the child wants. So you have to move very slowly, because very often the response to what a child wants to do is delayed.
Yeah.
So maybe they want to turn their head, but it will take them some time to actually do that.
Okay.
Yeah, so the first thing you can do is in this position, laying down.
Laying down.
Yeah, so from this position, what you also can do, and I'm going to turn you to your side, Pia. So, is you can make the child lay on the side.
Okay.
And then what you see, what's usually happening is that the head comes up. If the head doesn't come up, you can help a little bit here at the shoulder. Yeah, so you just turn the child to the side. Yeah, and then the head would usually come up. Can you lift your head? Yeah, you see like that?
Yeah.
This is another way that you can really work on the muscles.
Okay.
If it's too much to only hold here, and I'm pulling a little bit in this direction of the feet.
Yeah.
If that's too hard, you can just use here the shoulder, and you help a little bit here in the shoulder, again downwards. Don't hold this position too long, because very often kids don't like it. It's this in between position that they think, what do you want? Do you want me to go on my back? Do you want me to go to my belly? What do you want? So you just hold it for like a few seconds, and then you turn them to their belly, or you turn them back
So
to
it
their
should
back.
take like not minutes, just seconds.
Yeah. Because usually they don't really like this position.
Yeah.
It's a nice position just to play at. You can have your child play in this position, give them a toy, because you see now already the hands come together, so it's easier for the child to play. They are bothered by the gravity which they have when they're on their back. But if you really want them to lift their head, then it's very it's very unclear for the child what you actually want from them, because usually they only lift their head when they would turn to their belly. Yeah, and so you can do that both sides, of course. So you can also like turn the child onto this side, and then again make them have their head come up like that. Also,
So you're pulling with this.
yes,
You
I'm
pull the
helping.
shoulder.
Yes. So I'm pulling the shoulder a little bit down, but you can also do it only here.
Okay.
Yeah, so when you've done that, you can also continue to turn to the belly. Let me go, and then like from this position, you need to make sure the arm is up, then the child can turn to their belly.
Okay.
Yeah? I think, Pia, you have to turn around now. Can you turn around, Pia?
Turn around, Mama.
Yes, turn around like that, with your legs to the other side. Oh. Yep. So this is another position to really work on the head control.
Yes.
But very often this is a very difficult position for children with cerebral palsy. They will not be able to either lift their upper body up or to lift their head up, because then maybe everything would lift up.
Yeah.
Yes. So what you can do to make it easier is you can either use like this kind of like the bobby pillow or like a feeding pillow, or you just use
A towel.
a rolled up towel. Pia, can you lift up a little bit? Yes, like that. So you put that under the chest with the
on the
arms.
chest, huh?
Yes, under the chest, and then the arms over. So what happens is that the upper body is already lifted a little bit, so they have to work less hard here.
Oh.
Yeah. What you do not want is then the child looking up only. Because if the child is looking up, they probably are using these muscles.
Okay.
And what you actually want is them to use their belly muscles. So you want them actually to look down. So what you then can do is have them look down at a book.
Oh.
Yeah. So as soon as she's looking down, she will more engage her core muscles compared to only extending and using her back muscles. So in this position, they can look at a book, and you can make sure that they're like looking down. You can put a mirror, you can put something that they can feel.
Just something interesting?
Something interesting, yes. If you just want to work on the head control, it might not be a good idea to be something that they really like to touch. Because you want them to support on their arms.
Oh, yeah.
Yeah? So you want them just actually to look and just keep their arms only for supporting themselves.
Yes.
Yeah, so looking at a book is usually really good, or like the mirror, but they should not be able to lift their hands.
Okay. Okay.
Yeah.
So that supports their neck.
Yeah, so this way she's really working on keeping their neck up.
Okay.
And again, what you also can do if they are very interested in faces, you just go and look ahead of the child, and again with a toy, you can make them look left and right. Pia, can you remove the book? Yeah, so you can make them follow the toy, not only with the eyes, but with their whole head. Make them turn their head. You're not turning your head. You're not turning your head. Turn your head. Yeah, so again, but that will require a lot of head control already.
Yeah.
Yeah? But with the towel, you can do that very easily. The higher the towel, the more support, the easier it is.
Oh.
Yeah, but make sure the arms are over and that they can support with the elbows on the surface. So it should not be that high that they can't support. The elbow should be able to support on the ground.
Okay.
Yeah, and in the last position, of course, in which you also can practice the head control is in sitting. So you can do that in the sitting position. I would usually always like to do that like this with the kids. Can you come and face me? Oh yeah, like this, yes. So you can just sit like this. You don't have to look on that side, leave it, look at me. So what you can do is try to get like eye contact. Eye contact.
Yes.
And when you have the eye contact, you can have the child look to the left and the right. Can you look at, let me turn a little bit like this then. Is it bothering you? Bio.
So as they look to you, there's ability to be able to control their neck and to control their end.
Yes. So they look up. So what you can do, you can, for instance, start moving them a little bit to the left and the right. And you can sing a song like row, row, row your boat. Like, row, row, row your boat. I'm trying to make eye contact, but my assistant is not really helping me. Gently down the stream. Merrily, 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 life is but a dream. So you can see if I do like this, she tilts her head.
Where should you be holding the place that you're still holding?
Yes.
You don't need to hold the shoulder.
It depends a little bit about how strong the child is in the trunk. Some kids might need the support here. Okay. Sometimes they need then the support is here. Okay. Yes. Okay. Yeah. Okay. But you want to try to make eye contact. Then every time you move like this, you can see she curves her body and she tilts her head.
For how long can a parent do that with their children?
As long as the child likes it. Yeah.
So you can try it for 2 minutes and then later again some more 2 minutes, then later again.
See, what I usually say is in my work, I don't do crying children.
Yeah.
You want the child to learn something.
Yeah, yeah.
If a child is crying, they're not having a good time.
Yeah, yeah.
And to be able to learn something, you need to be willing and be open into new things.
Yeah.
So if the child is crying, it will be reluctant in learning something new. So it's no use of like a child crying or you continue when the child is crying. So you can better soothe the child down and then you continue again. You don't have to give up with the first fuzz because sometimes kids are just new to something and they don't know what to expect and it's difficult for them, especially being on their belly is sometimes very hard for them. Yeah. So you just, that's the microphone, don't touch it. So they might not like it and start fuzzing really soon, but it's like training. It's like when you start running, the first few times it's not fun, but when you get stronger and when you get fitter and better, it's becoming easier and you get fun. So that's the same with developing head control or any exercise. If you get better at it, it's becoming more fun.
Okay, so those are now activities that can help control the end, can help the activities that a parent can do at home to help them support their end, support their neck.
So what I want to add is what you very often see is that kids are being pulled up by the hands. Pia, can I show with you? So the child is lying down like this. And then for them to come to sit, parents just pull them up like this.
Oh, okay.
That is what doctors and therapists might use as an assessment to see how strong the neck is.
Yes.
But it should not be a way for you to help your child to come to sit.
So that should not happen.
No, and it's also not a good way to help with the head control. What you can do is actually the opposite. So when the child is sitting like this, you try to make eye contact and then you slowly
pull them
bring them down until they're not able to hold their head. So you make sure that you secure the head here in case they are not able to hold it. And again, what they need to do is this movement. And they engage their belly muscles, their core muscles, compared to their back muscles. Yes. So you can move them a little bit behind, and when you feel like this is as much as they can go, you just bring them back. Yeah, it's just hold them like this. Keep your head here, just in case they don't hold it anymore, and you can bring them back.
And let me ask you, Fonda, what if the child is sleeping on the floor? Like, just do it. Like the child is sleeping on the floor and they have issues with their end and neck control. How are you supposed to raise them up? Maybe from the bend and
I would do it via side lying. So if I would do that, I would actually first turn to the side and then lift them up.
Okay, all right.
So the head is more supported. If you do it like this, sorry, there you go again, Pia. If you just do it like this and the head is not strong, you might have like this and it's not pleasant for the child. If you do it first rolling to the side, then it's already easier for the child. And you just lift them via the side and you lift them up.
Amazing, amazing, amazing. Do you have something to add? on end and neck control. Viewers, you can also as well ask as many questions as you can on the comment section. I'll pass them to Fonda and she will be able to respond to you.
Yes.
If you also want to get Fonda's email or to contact Fonda, I'll put our email address and pin it and on the comment section, then you'll be able to get in touch with her. Thank you so much, Fonda.
You're very welcome.
See you on the next video. Bye-bye.
Bye.
Say bye.
Bye.
Okay, good job.